Today I'm going to talk about preeclampsia. What is preeclampsia? Preeclampsia is sudden elevated blood pressure in pregnancy at 20 weeks of gestation or more than that, plus protein in the urine. The blood pressure measurement can be 140 millimeter of mercury systolic reading or more than that, over 90 millimeter of mercury diastolic reading or more than that, and these occur during pregnancy. What are the predisposing factors for a woman to develop preeclampsia? Number one is an history of preeclampsia in a woman's previous pregnancy. History of elevated blood pressure outside pregnancy. History of diabetes mellitus outside pregnancy. History of multiple gestation. If a woman is carrying more than one baby, it can be twins or triplets. This can be a risk factor for a woman to suddenly develop preeclampsia in pregnancy. Age is also a factor. Age lower than 18 years of age during pregnancy or age more than 35 years of age during pregnancy. These are all the risk factors that can possibly predispose a woman to an onset of preeclampsia. What are the signs and symptoms of preeclampsia? Sudden onset of elevated blood pressure at 20 weeks of gestation or more than that. Severe headache in pregnancy. Visual disturbance. The woman will be experiencing blurry vision. In a severe case, the examiner, the person assessing the woman, can also see that there is corneal engorgement. Another thing is that the woman can experience nausea, vomiting as well. There may be pain in the upper right side of the abdomen. That is the location of the liver. Because of the liver involvement, there will be reduced urine output. There will be protein in the urine. If a bedside strip is used, it will be more than 1 plus of protein. These are all signs of preeclampsia that a woman and her healthcare provider should not ignore during pregnancy. Preeclampsia happens during pregnancy. It can be worsened at any time. If it's not peaked during pregnancy, or if the blood pressure is not well controlled during pregnancy, it can actually continue till postpartum period. So women can experience preeclampsia during pregnancy, during intrapartum, or even after the delivery of the baby in postpartum period. What have the treatment regimen for women in this condition? The most important thing is that if a woman is accessing care in primary health facility and she's been diagnosed of sudden onset of elevated blood pressure plus protein in the urine, it's more advisable for her to go to higher level of care in order to be managed appropriately and to prevent complication. This is very important, and the care will depend on the woman's condition and the gestational age of her pregnancy. The obstetric and gynecologist will work hand in hand together with other experts like nephrologists if they need be, and they will have to carry out some tests to know the systemic functioning of the woman. The EU and creatinine will be done. Urinalysis also will be done to know the kidney functioning. Liver functioning test can also will be done. Clotting studies will also be done to actually have a clue to the systemic functioning of the woman, and to know if there is some organs involvement, to know how to take care of this woman appropriately to prevent complication from this condition. Because if it not being managed well at the stage of preeclampsia, it can go to complications such as eclampsia, a form of seizure fit, which is not good. Another thing is that it can affect the renal functioning. It can cause kidney failure. It can cause kidney failure, it can affect the lungs, and it can threaten mother's life and the baby's life as well. Premature detachment of the placenta can happen, which can cause intrauterine fetal death. So it's so important to manage this condition at pre-eclampsia stage. I've come to the end of this video. Thank you for staying with me to the end. As a pregnant woman, expectant mothers, I wish you healthy baby to healthy mothers and family. And until next time, I will be doing another video. Take complete charge of your health, and bye for now.